Hey, y'all. This is the most important thing about fever to a pediatrician. I'm Dr. Parker Ellison. I've got 35 years plus of seeing lots of kids over the years and an active clinical practice. And I have seemingly had millions of situations dealing with fever, as you can imagine. The most important thing about fever is not the height of the fever, nor is it how fast the fever came up, nor is it how long the fever stays up, nor is it how long it takes the fever to go down, nor is it how long the fever's been going on. No, the most important thing about fever to a pediatrician is how does the child feel? Especially, how does the child feel when the fever eventually comes down? That is the most important thing to a pediatrician. How do they feel when the fever's down? I'm not giving medical advice for any specific illness, but in general, most infections that cause fever in children are self-limited viral infections for which treating the symptoms is really the only thing you can do. The best sign that it is one of these self-limited viral infections is that the child does not complain of anything specific, no sore throat or abdominal pain or a junky cough or something like that, and the fact that they usually feel and act almost normal when the fever comes down. That is what is really important to a pediatrician. I know that fever is one of those things that really makes parents nervous. I get it. Despite pediatricians trying to convince them otherwise, parents really worry about fever. They're sure it's causing some type of permanent damage, particularly brain damage to their child. Let me just say that just doesn't happen. Fever certainly makes kids feel bad and they cry more and they're miserable and they're fussy and they don't sleep and maybe they throw up and maybe they even have hallucinations if the fever is really high. I've seen every one of those in my own kids. But none of these cause any kind of significant permanent damage, no permanent damage at all. So please try not to worry so much about fever. Fever is certainly something, it's a sign. But it in and of itself is not a massive problem. Anyway, back to what I was talking about a minute ago. If your child doesn't have specific symptoms and they feel normal, particularly they feel normal when the fever comes down, you are most likely dealing with a self-limited viral infection. That doesn't mean that it is wrong to get your child checked out for fever. Fever is a very appropriate and very common thing to be checked out for. Fever is telling you something is going on. So it is appropriate to get it checked out, particularly in the young infant group, the infant age group, since their symptoms can oftentimes be more misleading in that age group. So I'm not saying to not pay any attention to fever. I am just saying that this one aspect of the symptoms of fever is immensely helpful to a pediatrician in evaluating potential causes of the fever. And hopefully, it can help parents think more clearly about fever and its causes and its implications. The question may come up, do you really need to treat fever? It is true that your body actually fights infections better at a higher temperature. So there is good reason to let the fever burn itself out and let it proceed and let your body's immune system work more efficiently at the higher temperature. But if the fever gets high enough, your child is just more miserable, gets more and more miserable. So most people opt for treating the fever with acetaminophen or ibuprofen to get the fever down. Getting the fever down is not to prevent serious harm to your child. It's not for that. It is more of a comfort measure to get them feeling better sooner, sleeping better, and feeling better, just feeling as normal as they possibly can. You can give acetaminophen and ibuprofen at the same time if you need to. If it's the middle of the night or the fever is really high and they're really miserable, that's perfectly fine to do and is particularly common to do, like I said, when the fever is high or it's the middle of the night or something like that, like something like that might happen with a flu illness or something like that with 103 or 104 illness. So again, I am not giving advice for any particular illness. I'm just educating parents about how pediatricians think about fever and sick kids in general. So don't lose the forest for the trees when it comes to fever. If your child feels good when the fever is down, that is extremely reassuring to a pediatrician. There's more information like this in my other videos if you want to go check them out.